for joining us today in this webinar. We'll start with the introduction of our Indian Road Safety Campaign. Indian Road Safety Campaign is a part of SOLVE Foundation and is working towards the mission of making Indian roads safer, focusing on reducing the number of deaths caused by road crashes. To achieve this, IRSC is working with 1,500 plus institutions and 25,000 plus volunteers across 26 states in India. And we are working in various domains such as awareness, technical innovation, law, policy, medical, etc. We work with a close association with our Ministry of Road and Transport Highways, Ministry of Health and Family Welfare, State Traffic Police, United Nations, WHO. Our main aim is to change the scenario of road safety in India. Indian Road Safety Campaign started the Journey to Safety webinar series in an effort to bring all stakeholders of road safety on one platform. As of now, we have completed 17 webinars and we have been covering various issues of road safety with experts from universities, healthcare, ministries, corporate institutions, and we have been having participants from different sectors and from all over the globe. We have had several prominent speakers in our previous sessions, like Dr. Eva Molnar, former director of UNICE. We've had Abhay Dhamle, former Joint Secretary, Ministry of Road Transport and Highways, India. Dr. Etienne Krupp from World Health Organization. Mr. Piyush Tiwari, CEO and founder, Save Life Foundation. For people who had joined us in our last webinar, we also we had a session with Ms. Babni Lal, who was from the Transport Research Wing. And we discussed about how Transport Research Wing works and how they collect data. Today, we have invited Dr. Nhan Tran to discuss about gender equity in road safety solutions. I'll hand over this session to Mr. Ivy Rao, the host for our session. Sir, please take over the session from here.
Thank you, Swati. It gives me great pleasure to welcome our guest speaker for today, Dr. Nhan Tran, all the participants and friends. Good evening. I'm very happy to host this 18th weekly series on road to safety being organized by IRSC. This week, Dr. Nhan would be talking about a totally new issue, gender equity in road accidents. Road safety is a complex subject and needs contribution from all stakeholders to make roads safer for users. For the benefit of our esteemed speaker, I would like to briefly talk about various issues of concern for road safety and status of gender equity or inequality in India to set the context. UN had declared a global plan for the decade 2011 to 2020 of action for road safety and recommended 5 main pillars for road safety namely road safety management, safer roads and mobility, safer vehicles, safer road users, and post-crash response and emergency care. The Central Motor Vehicle Act has been modified last year with a lot of improvements and also increasing the penalty for not following any of the traffic rules. Unfortunately, in India, we still do not have any evaluation of the accidents taking place every day to understand the reasons for accidents. JP Research is the only organization which is located in Bangalore who are doing this analysis, covering only some parts of the country. As per 2018 Ministry of Road Transport data about road accidents, it indicates increasing trend in number of accidents. About 4.6 lakh accidents occurred in 2018 with about 1.4 lakh fatalities. Sorry, a lakh means is 100,000, which is 0.1 million basically. So in terms of millions, 0.46 million accidents and 0.14 fatalities. The big concern is the fact that 72% of the fatalities are with mid-age group who are in most productive phase, which affects our growth. And 35% accidents cases involve two-wheelers and about 24% cases four-wheelers, and fatalities also show similar trend. 75% of the drivers involved in accidents have valid driving license. In case of two-wheeler users, as per recent survey, only 30% of the drivers and 10% of the pillion drivers use helmets. In case of fatal accidents, 29% were not using helmets. Same is the case with wearing seat belts in passenger vehicles. Based on survey conducted in 2018, only some 28% drivers and 4% rear seat occupants were wearing seat belts. In this also, many do not feel necessary to use seat belts when they are making small trips to nearby locations. In case of fatalities, 38% drivers and 62% passengers were not using seat belts. When we look back over last decade, India has considerably improved our road infrastructure. Automobiles being made almost at par with Europe. Awareness amongst the road users has improved, and post-accident emergency and treatment services also have been improved. But still, India has not seen any improvement in the reduction in accidents and fatalities. Still, a lot needs to be done. It was highlighted by many in previous webinars that we do not have full information about all the accidents. If the accident analysis is done well, would clearly indicate what caused the accident and who is responsible. These inputs will help vehicle designers to configure the systems well. The ministry and authorities will have clear picture in formulating regulations which would be effective in India, and also design the roads better and eliminate the existing red spots. This would also be useful in focused training and the drivers and road users better. Few weeks back, we had Mr. Ravi Shankar, the technical director of JP Research India office, which analyzes the accidents taking place in some parts of India. He talked about the accident analysis and power of information for improving road safety. Last week, as Swati mentioned, we had Ms. Babni Lal from Transport Research Wing of Ministry of Road Transport. She spoke about data being collected by Transport Research Wing of MOTH and various initiatives for real-time collection of accident data. This week, we have Dr. Nhan Tran from WHO, World Health Organization, will be talking to us about gender equity in road safety. Dr. Nhan Tran was born in Vietnam and grew up in the United States, where he completed studies in international relations and modern languages. He graduated in international public health, and he is a PhD in health systems research with emphasis on road traffic injuries from Johns Hopkins University School of Public Health. Dr. Tran worked at the regional and federal levels of United States Department of Health and Human Services in various capacities, managing programs and as a science advisor. As a researcher at Johns Hopkins University, Dr. Tran was engaged in health systems and road safety research and helped establish the International Injury Research Unit. Dr. Tran joined WHO in 2011. Since October 2017, Dr. Tran is the coordinator of the Unintentional Injury Prevention team within the Department for Management of Non-Communicable Diseases, Disability, Violence and Injury Prevention. He coordinates work in the areas of unintentional injury prevention, focused mainly on road safety, injury surveillance, surveys, and alcohol and drug-related injuries. To link with the topic for today's lecture, I would like to describe gender equity or inequality status in India in general. The sex ratio in India as per last census, that is 2011, is about, for every one female, there are about 1.064 males. Women's share in total workforce is about 32%. Uh, the literacy rate, male 82.1% and females are 65.5%. Total enrollment for higher education has been estimated to be 19.2 million. The males are about 18.2 million. Females constitute about 48.6 of the total enrollment. The total number of teachers, about 42.2% are females. In all India level, for every, there are merely 73 female teachers for every 100 male teachers. Uh, uh, and with respect to the PhDs, uh, there were about 17,048 females in the total of about 40,800 students who were awarded PhD. In case of higher the students enrolling for graduation, the maximum number enrolled are for arts courses followed by science. In both the cases, females are about 53%, which is higher than males. And in case of commerce subject, the females are only 48.8% compared to males at about 51.2. And in case of engineering and technology, which is the fourth major stream, the females are nearly 28.9%. And in case of medical sciences, is much lower. Sorry, in case of medical sciences, it's quite high, more than 50%. And in management, it's very low. So to promote more female students to take up these professional courses, many states have come out with reservation policy for female students so that it will be easier for them to get into these courses. In case of workers, representation of women in Central Council of Ministers is about 10.5%, and in Lok Sabha we have about 14% women members, women MPs, and in case of Supreme Court we have 9% women judges, and proportion of women in management positions for 1,000 persons engaged in managerial positions, the women are only 90. And also in police, the females are only 7% as of January 2019. And in case of workforce, women comprise 22%, while 28% of men travel on foot to their workplace. 54% of women travel to work by foot. And share of women using bicycle to travel to work is also very low, almost 5% compared to 22% by men. 20% of women rely on buses to travel to work as compared to 16% men. And usage of two-wheelers is also higher for men at 20% as compared to 8% of women. Share of women walking long distances is about 6 to 8, 10 kilometers is also higher than men. 8% of women travel to work by foot in this distance category as compared to 5% men. Analysis of travel to work data of 5 cities, Bangalore, Delhi, Calcutta, Mumbai, and Chennai, revealed that on average, 37% women walk to work compared to 27% men. And also, sexual harassment is one of the main problem being faced by females. And as per some survey done, most of these cases happen when women are waiting for transport or in the public transport itself while while traveling. And also, a lot of state governments are encouraging. Actually, transport sector is considered as no women segment, but of late, where different states are encouraging women to get into the uh, driving, also bus conductors, etc. And also, states like Kerala and Pune have specially encouraged females to become auto drivers, and also they are creating a lot of infrastructure to support this initiative. But most of the metros like Mumbai, Chennai have very few women auto rickshaw drivers, and also there are very few bus drivers and no, I mean, hardly any truck drivers. Though percentage of women buying vehicles can be worked out from the registration data, but it would not confirm these vehicles are being used only by females, as most of the families buy vehicles on different names for various reasons. The percentage of women driving vehicles is increasing in urban centers. Generally, all auto manufacturers design the vehicles meeting the various international standards, mostly using male mannequins for deciding all safety requirements. No system is specially configured keeping female users in mind. Only some features are being offered to attract women in some specific segments. In India, the accident-related fatalities involve males in 85% cases and females in 15% cases. And in case of females, maximum casualties, fatalities occur at the age group higher than 50, unlike males, where maximum number of fatalities occur in the age group of less than 45 years. The number of women who have learned driving have increased by 26% in last 5 years compared to 23% in case of males. In last 5 years, there is about 12% increase in female buyers, and the vehicle manufacturer also offering some special features to attract female buyers. In in the above low figures about female users in accident, why does gender matter in road safety? I would like Dr. Nhan to elaborate on this issue. Over to you, Dr. Nhan.
Thank you very much, and thank you for inviting me to join this discussion and for providing such a comprehensive overview of the situation in India. I think you've actually covered a lot of the very important aspects of gender, but I think I would just like to add a few things. I mean, I think that when we think about gender and equity, we have to think about what is the purpose of a transport system or a system of mobility. And that system is meant to serve an entire population, both men, women, boys, and girls. And when we look at the data, certainly the data that you've described, as well as the data from India, as well as data from other countries, we see a very similar trend. We see that many of the deaths actually occur among younger men, young boys, and men, and that only a smaller percent of the deaths actually occur among women. And on the surface, it may look like it's actually a problem that is more for men, and actually women are better off because of that. But when we look at that statistic, and when we look at the data that you've cited, sir, including the data about the types of trips that are being taken, the types of vehicles that are being used, we start to realize that, in fact, the reason why more men die as a result of road traffic crashes is because women's participation or women's engagement with the transport system is much more limited. Whereas more men are likely to take cars, drive motorcycles, or other motorized modes of transport, women are more often likely, as you've rightly said, likely to walk, cycle, and so forth for a various number of reasons. We know worldwide that women are also more likely to use public transport. And so part of what the picture that you're describing shows us is that, in fact, the transport system that exists in many countries, including India, isn't actually designed to serve the needs of both women and men equally. Because we see that, in fact, as is the case in India, more men are using the system as it is designed now, and women are often left to to walk or to use other modes of transport. And therefore, that's part of the reason why we don't see the same level of deaths among men as we do among women. So for me, what this means is that we have systems around the world, and including in India, that essentially do not serve adequately the needs of women. And so that is part of the problem that we're trying to address today. Because the question is that when we have systems that are designed, transport systems or systems of mobility, should these systems not serve both sexes, women, men, boys, and girls, equally as they do equally? And the answer that we are seeing now is no. These systems do not serve the needs of women in the same way that they serve the needs of men. And the reason for that, as you've rightly pointed out or alluded to, is because the systems have been designed largely around the needs of men and largely by men. So part of our challenge moving forward is actually to reimagine how we design systems that are responsive and that adequately meet the needs of women as they do men. So that's part of the question that we're starting to ask ourselves. And to answer that question, we are asking ourselves, what is the information that we need? What is the data that we need to actually design these systems in a way that would allow them to be more equitable? And on that point, let me just elaborate. We in the field of road safety often collect data about injuries or death, and we focus on that as being the driving force behind how we target the interventions, how we redesign roads and mobility systems. However, we're recognizing that that level of data alone is insufficient to provide us with information about whether or not these systems are actually meeting the needs of women. So the question is, so rather than looking at only a number that says, this is the number of women that are dying, this is the number of women or girls that are injured, what we want to start doing is looking at the experience of women and how they use or interact with mobility or transport systems. And when we start to do this, we start to learn a lot more interesting things. As you've rightly said, men are more likely to use cars. Men actually travel much longer distances. And most of the time, men are traveling or using these cars to go to work. And actually, that has been the driving force behind how many of these road systems were developed. They were developed to facilitate economic activity. And for a very long time, the way that governments assessed how roads were being used or the number of trips that were being taken or how they should respond was to really enable more economic activity. And by and large, historically, men were more engaged in economic, quote unquote, economic activity than women were. And that's due to cultural reasons that exist all around the world. However, what we see is that women all around the world, whether you're talking about India, whether you're talking about the United States, or whether you're talking about Switzerland, where I live, actually take much more smaller trips. And they take trips for other reasons that are very important, but nonetheless do not get captured in these types of surveys that look at, is a woman traveling for economic, going to work? The answer is no. But is a woman accompanying her parents to go to the hospital? Is a woman accompanying her children to go to school? Is a woman accompanying her children to other extracurricular activities? And the answer is that women are actually much more likely to make those types of trips than men. However, when these types of surveys are done, they often overlook the importance of these types of activities because they are not, quote unquote, economically productive activities. And so when the people that design roads or design mobility systems are sitting around the table discussing how should we design our systems, they're thinking, well, these are the types of trips that people make to go to work. And therefore, we need to facilitate that. But they rarely think about the importance of these other trips that are made throughout the day and for other purposes. So I'll give you a very concrete example of how this is actually playing out in modern society. We all know that there is rush hour, right? Usually it's in the morning between 7 and 9 a.m. and then in the afternoon somewhere between 4 and 6 p.m. And during those hours, we see that there's actually more, how should I say, efforts to increase, for example, the frequency of public transport to accommodate, again, workers. So you can see that the response has always been to accommodate the needs of workers or people going for economic activities. But there hasn't really been a lot of thinking around how do you actually design a system that actually facilitates or enable transport throughout the day and to enable these other types of trips that women are more likely to make. So that's part of the challenge, and that's part of the reason why we start to look at the issue of gender, because we start to understand that when we actually have numbers that show that it's largely men dying, it's largely men driving cars, it's largely men driving motorcycles, we start to realize that the systems that have been put in place in many parts of the world are actually not designed with women's needs in mind. And that's part of the problem that we're trying to redress.
Yeah, very interesting. As we know, what gets measured gets done. Unfortunately, we lack as you also mentioned, gender segregated data in general, and more especially on road safety and about accidents, etc., which prevents evidence-based policy making. So, Dr. Nhan, can you share your views on challenges that the governments are facing in this area? What are the actual challenges in terms of collecting data, gender specific?
So I think that part of the challenges related to what I started to say before, we do actually have data, and actually in India, for example, you know, about 80% of the deaths occur among men and 20% of the deaths occur among women. We do know, however, for example, that when there is a crash in terms of severe injuries, more women are likely to suffer from severe injuries, and that is precisely due to what you said, sir, earlier, that many of the safety features in cars have been tested on dummies that were based on masculine physiology and anatomy. And because of that, they don't actually offer the same level of protections against women. And again, this is an example of the type of biases that exist. So in terms of the type of data that is useful to help guide policymakers, I think we have to actually go much deeper than just looking at the number of deaths. We actually have to look at how the system is designed. And I would start quite simply by looking at, for example, does the system take into consideration the needs of women? And if so, how do you do that? Do you have a mechanism for understanding, for example, what types of needs women have? Do you collect that information in terms of mobility and transport? And do you have a mechanism for analyzing how the transport system is responding to that? That's one bit of information that we currently don't have in many parts of the world. And I don't want to suggest that this is only an issue for countries like India or maybe Vietnam, where I'm originally from. But actually, in many parts of the world here in Europe and in North America, they don't actually have this type of information, because the way that the data systems have been set up has been very skewed. It's been looking at quantitative data. And what we're seeing more and more is that if you start to introduce the qualitative data, you start to have a very different picture. So for example, what you were mentioning about the safety or the security aspects of transport. Many women have reported that they don't feel safe in terms of taking public transport for a number of reasons. And again, this data is seldom collected and seldom used in decision-making when it comes to transport planning. And it's this type of data that could actually be very informative if you want to improve access to public transport. It may not be by offering free public transport to women. If you don't address the security issues, that's not going to solve the problem. So I think in terms of developing policies that are very promoting gender equity, I think you have to start trying to understand the perspectives and the experiences of all road users, and not just look at the sort of the quantitative indicators such as the number of trips that are taken and the distance of the trip, but actually trying to understand what is the experience with those trips and by the various users, and how can the systems be improved to be more responsive to those? Because the more that the systems are responsive, the more that people will engage with the systems.
Does this mean that to ensure that different needs and concerns of women and men, road users, to be well integrated in road safety strategies, do you think it's important that all the road safety agencies employ both women and men in decision-making roles? And which are the countries to benchmark on this issue? Which are the countries that have successfully integrated women in these male-dominated roles in the sector?
I think there are two distinct issues here I would like to clarify because I think they are important. I think there is an issue about the decision-making processes, who's responsible for that. And then at the implementation, then you're talking about whether or not women are engaged as planners, whether women are engaged as engineers, whether women are engaged in road construction and other activities which we described earlier. So let's go to the decision-making part of it first. I think that we have to be very, how do I want to say? I mean, I think that there has been an assumption that a lack of, sort of participation is indicative of a lack of interest by women in certain sectors or certain roles. And I think we realize that that's simply not true. I think in many countries, we still see that there are more men in decision-making roles than there are women. And the most simple way of correcting that is by actually implementing a policy where you actually have equal numbers of women and men in decision-making roles. And that is not hard to do. People assume that, oh, well, they're leaders. It's simple. When you have a cabinet, when a new government comes in and you have a cabinet, do you have equal numbers of men and women? That's a very, very simple thing. But the fact of the matter is that very few countries do. So that's one issue. But yes, to answer your question, I think that it's absolutely necessary. And I'll tell you why, because I don't think that men are able to represent the viewpoints and perspectives of women. In the past, there has been a lot of talk about, do men need to be more sensitive? Do men need to be trained on how to be more sensitive? Do men need to be trained on how to understand or appreciate the needs of women? Yes, they need to do all of those things. But at the end of the day, women represent their viewpoints better than men can. And there's no reason to suggest that you should just train a man how to be more sensitive so that he can represent the needs of women better. Just put a woman in that role. So that is very easy to do, but I think it requires overcoming a lot of social, cultural norms that have been ingrained in our societies for a very long time. The second part of what you asked is really about, are women adequately engaged in the design, planning, and execution, implementation of mobility and transport systems? Absolutely no. But again, there is some interesting studies that have come out of the last few years that have shown, for example, that despite the fact that women have been recruited, for example, as transport planners, or transport engineers or in some of these roles, that there are a number of women that tend to leave these positions within the first couple of years, within the first 5 years. And one interpretation is that, voila, that is further proof that women are not interested in these roles. An alternative, and one that I would actually tend to agree with more, is that, well, even though people have made attempts to recruit more women, the environment itself is hostile to women. Imagine if a woman comes into a workplace that is 90% men, and the whole culture is very male dominated. That woman is not going to feel welcome or comfortable there. So I think that, you know, sometimes we only think about the immediate things. We think, oh yes, let's recruit a woman in this role. Let's make sure that we hire a woman. And then we think that that solves the problem. Well, it doesn't. You know, in order to actually have a meaningful engagement of both genders, the actual workplace, the actual work culture, the sort of the cultural norms that we have at work also need to change. Otherwise, we get into this situation where you have recruitment, but we're unable to retain the women and others who actually need to be part of this process. And that is the challenge of actually thinking about how do you actually make this a meaningful opportunity for both men and women to engage. And I don't think that there are great examples of this, there are countries that are perfect at this, but certainly there are countries that are doing a better job of this. For example, we know that in Canada, for example, they have implemented what is called a GBA, which is called a gender-based analysis. And that means that for all policies that are made, irrespective of what they are, including transport or others, that there is a gender-based analysis that is carried out. And what that gender-based analysis does is it asks the question, what is the impact of this policy on gender? Will this policy somehow unintentionally or contribute to existing gender inequities? Or does this policy somehow, is it gender neutral, or can it somehow improve the situation? And again, when these policies, when these analyses are done, it allows governments to be informed of the potential impact before they pass these policies. And when we see that this requirement of having a GBA in place is actually acted upon, it results in much better policies that do not inadvertently contribute to gender inequities. And so there are very simple things that can be done as a check for governments, as a check for decision makers to see, are we actually unintentionally being biased or prejudiced in the way that we are developing or formulating these policies? And that's a very simple tool that has been used in countries like Sweden, in countries like Canada, that has actually shown good outcomes.
Canada would be a good benchmark to follow for India, but India being what it is and with so many states, so much different cultural background, etc., I think it's a big challenge for India to really achieve what you have just mentioned. But still, I think there's a lot of merit in what you are suggesting, to have both males and females in equal numbers to all the bodies where policy decisions are taken. My next question is, Vision Zero is ultimately a gender-responsive approach as it aims to provide a mobility system that can address the needs of all road users, men and women, boys and girls alike. Can you share with us if and how the narrative around gender equality has been introduced in and has been adding value to the Vision Zero discourse? Do you feel that reflecting gender perspective is important to the implementation of Vision Zero, and why?
So for me, I would say that the biggest takeaway from Vision Zero and the idea of safe systems is that it draws the focus away from the individual. There's a lot of talk about, are women worse drivers than men? Are men more risk takers than women, and so forth? And I find that those types of discussions do not really enable us to really move forward as a productive way as we could. Because what that does is it focuses on the individual. And again, it moves us to, this is a bad driver. This is a person that is not following the rules. And the idea, the fundamental idea behind Vision Zero and the Safe Systems approach is that we should design systems that respond to the needs of the users. And we should design systems that take into consideration human behavior and the fact that we as humans are not robots. We are not going to be able to drive perfectly. We are prone to having distractions, all of those things. And the idea is that a system works with humans and it allows the needs of all humans to be taken into consideration without penalizing. So if you design a system that only works for men, you are essentially penalizing the other half of the population. If you design a system that only works for cars, it basically penalizes all of the other modes of transport. And incidentally, more and more when we're talking now about the Sustainable Development Goals, we're actually trying to encourage systems that are not solely autocentric. That is, we want systems that are multimodal. We want systems that are actually enable walking, enable cycling, enable a use of a range of modalities. And that's much better for the environment, and it's much more sustainable, and it's better for our health as well. So I think the point that I'm saying is that for me, the Vision Zero and the Safe Systems is about thinking about the system and not the individual. And when we start to approach it from that perspective, when we start to ask ourselves, how do we make the system better and more responsive to the needs of users, then we are actually addressing, getting to the question of gender equity without actually having to make this a gender issue. The issue, the thing that's interesting is that it doesn't have to be a gender issue, but it has become one because we've allowed, and many parts of the world have done the same, they've allowed certain gender biases to inform the way that systems have been developed. Again, it starts to do with the roles of men and women in the workplace, who works, who doesn't, and the value that is placed on quote unquote economically productive activities versus those that are not seen as economically productive, like taking your child to the doctor or accompanying your sick elderly parent or visiting them, or for that matter, going to the grocery store to buy food. Again, all of those things influence the way we've thought about these systems. And when you start to say, let's focus on a system that is responsive to the needs of all people, that is what Vision Zero and that is what Safe Systems is about. You start to look at it in a very different way. It doesn't have to be about gender, and it shouldn't have to be about gender. But unfortunately, at this point, we do have some backtracking to do, and that's why it does have to be important that we look at this as a topic that has to be analyzed in order to ensure that the biases that exist are still not driving our decisions today.
The other question, which is related to what we have just discussed, is about the high percentage of males involved in fatal accidents. But we also know that half of the road traffic deaths are among so-called vulnerable road users. And we also know that generally women comprise a greater portion of these vulnerable road users and other road groups. So how do you ensure that planning, design, and the provision for road safety addresses the needs and concerns of both women and men, boys and girls, when resources are stretched and when statistics point to the disproportionately high male fatalities on the road? What are the arguments you have been using to ensure equity in resource allocation for road safety?
I think it's the same argument that I've been making, and that is simply that, when you look at the numbers, it's disproportionate. But we have to understand what the numbers are actually telling us. And for me, it's again the same message. the message that you see when you see a disproportionately high number of men dying in cars and motorcycles means that the systems have been designed to encourage those modes of transport. Whereas we don't have systems in many parts of the world that actually enable people to complete their journeys using public transport efficiently, using bicycles and using walking, for example. You know, this concept of vulnerability is quite interesting as well, because we tend to label people vulnerable road users. And again, you know, the concept of vulnerability doesn't suggest that a bicyclist is somehow just more vulnerable than a person riding a car. A bicyclist is more vulnerable than a person in a car because we've designed systems to really favor cars and car ridership. Even in Geneva, you know, we see that many of the roads, you know, are designed for cars, and then the bicyclist has to, you know, figure out how to navigate him or herself. A bicyclist, but when you look at cities, for example, in Copenhagen, in Denmark or the Netherlands, you see that the reverse is true. Bicyclists are not vulnerable there because they actually have a system that's designed to meet their needs. And so actually bicyclists are very safe. We would not consider bicyclists a vulnerable road user in Amsterdam, but we would in India, we would in Switzerland, because the systems are very different. So I think, again, this concept of vulnerability is a function of the user and the relationship of the user and the system that he or she is functioning in. And when you start to look from that perspective, you realize that what is really important is to think about how the system is shaped, how the system is designed to respond to the needs of these users. You can change the narrative and by changing the system, and women and bicyclists and pedestrians no longer have to be vulnerable road users if you design roads for them as well, as opposed to only designing systems that are for cars and then saying, oh, well, these people are a little bit vulnerable because, you know, cars can kill them. Well, separate them. There are a lot of things that we can do, but again, it's about these institutional biases that exist, that all of us carry around with us. And the thing that we can do to change them is to ensure that we have tools and spot checks in place to help check these biases. And that's why things, for example, like the gender-based analyses are so critical in the decision-making and the planning and the implementation of systems, because they are tools that remind us to check our biases, check our prejudices as we're going through the process.
Dr. Nhan, I would like to request you to tell us 3 most critical things that we should all be doing to advance gender equality in road safety immediately. Your expertise and your exposure to different countries, and you mentioned Canada has done a lot in this direction. So if you are aware of Indian situation, what would you suggest, recommend for India?
So the first thing, of course, is I think you have to have more data. I think you have to have more information about not only the number of deaths, not only about the trips, the number of trips that people take, but I think you need to collect data, and maybe there are research institutions and academic institutions in India that could collect this type of information, but you need to capture the experience of all road users and how they relate and how they engage with the transport system. And by that, I mean all of the things that you described earlier. It's not just about, you know, how many trips does a woman take? It's about what is her experience when she travels? Does she feel safe? What influences her choice when she plans a trip? Ultimately, they plan trips and they make choices. And these are the things that I think are extremely important to know, because that's how you start to change the systems, is by actually responding to the experiences and not just these numbers, which we are often very sort of fixated on. Because that's one very simple thing. Obviously, I think groups like yourselves have an important role in advocating for change and advocating for systems that are better suit the needs of women. And I think in so doing, the second thing that I think that is very useful is to actually focus on the systems and not on the road users. You know, don't get stuck in the trap of saying, oh, we need to give boys more sensitivity training. Oh, we need to train women to be better drivers. Oh, we need to do this and this for that for boys or girls or women versus men. The issue is not about the users. The issue is about systems. And what needs to change is systems, the system, not the users. And finally, I think what we've observed in countries that have actually done well is to actually have or impose policies that force much more inclusive decision making. And by that, I mean have equal representation of women in policy planning processes, in the decision-making processes at the high level. I mean, the numbers that you cited at the start of this conversation, 14 women, 14% of members of parliament are women, 9% of Supreme Court are women. Those are actually not very representative. So we have to change that. We have to actually make decision-making much more inclusive. And until we are able to achieve the level of parity that is required for us to have a really truly inclusive decision-making process, because that's not going to happen overnight, I think the best thing that governments can start to do is to actually use gender-based analyses that for all policies. Every time you have a policy, if you want to look at a new plan for a road design or infrastructure project, ask yourselves and use the tools that are available. What is the impact of this infrastructure project on gender? Will it impact men and women differently? And if so, how? Are there things that can be done to mitigate that impact, that adverse or positive impact? So I think, first thing is data. Second thing is having a focus on systems. And then the third thing is actually to have more inclusive decision-making. And until you reach that parity in the decision-making, use gender-based analyses to actually look at the impact of policies, certainly transport infrastructure policies, on gender equity. Those would be my three things.
Thank you. As a person coming from auto industry, I have a question for you. We design vehicles as per international standards about safety and emissions, etc. And all vehicles which have to be actually used in any country have to meet these requirements. Otherwise, they cannot be sold. So with that as a background, where do you think the change should happen to take care of the female requirements in safety, etc., which you also mentioned, and I also heard in some other panel discussion that the crash norms what we have right now are not safe enough for females.
So, I mean, again, and I should put out there that I'm not an expert on this topic, but I have listened to experts, and I would send you the names of the people that really do the research in this. I mean, certainly the way that we carry out these tests, and I also should say that, I mean, the UN isn't, we are not protected from biases. We, the UN, also sort of perpetuates biases. So when we talk about the star
all these standards are UN approved norms.
Exactly.
European Commission. Yeah, that's right.
And my point being that, even these commissions, perpetuate or the biases sometimes. So I think the first thing is simply to start actually looking at how these standards were achieved and the type of testing that was done to them to achieve them. And yes, I think that one of the easiest things is to start looking at testing products on both men and women. And again, this is not just in the auto industry. Historically, a lot of drugs, for example, were tested among men and not on women because women were not considered in those practices. So this is a legacy that has carried on for a long time. So the first thing that auto industry should look at is actually, yes, start looking at, whether or not your safety features are as impactful on the male dummies as they are for dummies that actually correspond to a woman's anatomy and physiology, which is very different. So you can change that by actually just how you engineer, how you test. You just change the subjects. And I think that's one part. And then the other part, again, is to include more women in the research process, but also in the development process. I don't want to make a generalization, but I think that if you start to involve more women, or if you had, let's say, 50% women and men in these types of design processes, we would come out with systems that look very, very different and possibly very safer. But we are right now at a position where we're trying to correct these things and say this and that. But I fundamentally believe that if you had more women sitting at the table, if you had more women sitting at the design, designing cars, they might look very different, or they would look very different because you have different perspectives. I don't think it's enough to just say, let's get a female dummy in there and have a man think about that. I think you actually need the female dummy, but you also need a female engineer and designer sitting there working hand in hand with the male counterpart.
There is a question from one of the participants. Can you share some insights on a country or agency that is performing well in gender equality and inclusion with regards to road safety infrastructure? It will be motivating and inspiring to know and understand how this is achievable. Also, what are key activities and which agencies are responsible for these activities?
So I think in terms of countries, there are a couple of countries, but there are also, for example, within the United States, there are cities that have done better than this. I want to say first and foremost that I don't think that there is a single country that is perfect in terms of gender parity and gender equity in terms of the representation of women at different levels. But we do see countries, and there are a number of countries: Canada, Sweden, there is Chile, Colombia. And we have, and I'm happy to send you a link to some case studies that have looked at this issue and some reports that I've actually compiled experiences from different countries around the world and what they've done. But a lot of what they've done is really around these issues of how do you actually understand the problem? How do you improve the collection of data to better assess the experiences of women? And the second really fundamental issue is really about how do you increase representation of women in the decision-making and in the planning for transport. And yes, we've Los Angeles in the state of California in the United States has a very interesting case study. I've also read one, for example, from Chile, and Mexico has done some stuff as well. But again, I'm happy to share these references, you can look at them. But there are emerging, but I will say that, none of these countries have actually fully solved the problem, because a lot of what countries are dealing with is a legacy of institutional failures, systems that have been developed, over time that have actually been developed with certain biases. And now what we're trying to do is to undo the effects of those institutional biases that are reflected in the transport, the systems, and how users are interacting with those systems. But yes, I'm happy to share some examples, and there are some positive cases that I think can be inspiring for the group to study.
There's one more question. How shall the regulatory bodies and authorities be constituted for the gender-based equity in road safety? On what domains it shall work on?
I think my answer to that would be the same as what I said before. And I think, if a system is intended to serve, both men and women make up half of the population, or roughly half of the population, then, all regulatory bodies should have the same representation. And I would say this for not just a gender perspective, but I would say this for if you're talking about race, education, gender, economic, socioeconomic status. Again, you know, in many countries, the people that make the decision are economically, socioeconomically at a higher level than the majority of the population. So you have a select group of people that are sort of presuming to understand the needs of all users. And I would argue that you need to have the same representation as you see in the population, making the same decisions, being responsible for the regulations. So it is about, you know, reflecting the constituents that are being served by these regulatory bodies.
One more last question. Is this vision zero of no deaths and serious injuries on our roads actually achievable? In your opinion, which country would achieve this first?
So, I mean, we don't have a country that has achieved zero, but for example, the city of Oslo in Norway had 0 deaths, has had 0 deaths, or close to 0 deaths. So the idea, so yes, I think it is achievable, but I don't think that, you know, that it is meant to say that, okay, you know, overnight you will have 0 deaths. I think the idea is that, you know, if somebody is going to intentionally drive into a car or into a thing, you know, for whatever reason, you're not going to change that. But the point is that you design a system that is really responsive to the needs and behaviors of people. That is Vision Zero. And the idea really being is that, you know, if you focus the system on, we are very focused on efficiency. We want to enable people to get somewhere faster and faster every day. The idea, the objective is to make it faster, but we don't focus as much on safety. So the idea behind Vision Zero is really saying we should care about safety as much as we do about efficiency. So as we, you know, in the future, you know, we're going to make it possible for people to go from Europe to India, maybe in 5 hours instead of the 10 hours that it takes me to fly from Zurich to Delhi, or 11 hours. And these are goals that engineers and scientists are doing every day. They're trying to make travel more efficient and fast and blah, blah. But are we making travel safer? That's what Vision Zero is about. Vision Zero is a reminder that we have an obligation, we have a responsibility as we design and create and develop, execute mobility to ensure that people get there as efficiently, but also as safely as possible. And my answer, my final answer to that is that, yes, it is possible to envision that you can achieve 0 deaths, because we don't always have to think about it as being a car-centric, you know, model. When you think of cars, you think, oh, people will make mistakes, they will drink and drive, they will do X, Y, and Z. But imagine if you didn't necessarily have to rely on cars to go to work. You didn't have to rely on cars to go to groceries. You know, that sort of concept, I think we don't think about enough. We always think about, okay, cars. But if you start to think about a multi-mode, you start to really separate cars, you have more bicyclists, you have more pedestrians, then you realize it is possible to drastically reduce the numbers.
Over to you, Swati.
Thank you so much, sir. Thank you, Ivirav, sir. Thank you, Dr. Nhan, for sharing your thoughts today. It was a really wonderful session. I would first of all like to thank Dr. Nhan for joining us and sharing your opinions, and also giving us 1 hour of your time on a weekend. We are really glad to have you here. Participants, thank you so much for joining us. Please join us back again next week, same time, for another webinar. Thank you, sir. Thank you, Evira, sir. Thank you, everyone. Have a nice day.
Thank you, Dr. Nhan.
Thank you, everyone.
Thank you.